Jim, thank you very much. It's really a pleasure to be here. Good morning, everyone.
Good morning.
It's good also to follow Bernie Winder. I appreciate your explanation on the disparities issues. I'm going to talk a little bit more about that. I know Gloria Lawlah will be here in a little bit. She's our Secretary for Aging and does a great job in getting information out. What we want to do is talk a little bit about what's in the Affordable Care Act. We are celebrating the 2nd anniversary. It's nice to be here with my colleagues in government. Mayor Grimm, always appreciate your hospitality, and Commissioner McKay and Councilman Scarpelli. I thank you all for being here today as we try to get more information out about the Affordable Care Act. I also want to acknowledge that we do have representatives from both Senator Mikulski and Congressman Bartlett that's here. I think Juliana's coming.
She's here.
She'll
Good morning,
Senator. Juliana's here and Brenda's here, and we thank both of them for being here. They're my colleagues in Congress. Of course, Senator Mikulski is my colleague in the United States Senate and was instrumental in many of the provisions in the Affordable Care Act, particularly as it relates to women being included in the bill that was signed by President Obama. We are celebrating the 2nd anniversary of the Affordable Care Act. And I want to start with the fundamental issue that I think is critically important. And that was a statement that at long last, America joined every other industrial nation in the world that says that health care is a right, not a privilege. That everyone is entitled to affordable, quality health care. For too long, tens of millions of Americans have been left out. Close to 40 million today are without health insurance, and the objective is to get all these people into the system. By definition, these people are not poor because they would otherwise be included under Medicaid. So these are generally working Americans who today do not have health insurance, and the concept of the Affordable Care Act is to bring everyone into the system, to say that health care is a right, not a privilege. Now let me tell you how it will affect different groups of Americans. We've already seen some of the impact. For our seniors, the Affordable Care Act makes it clear that first we're going to expand the benefits to our seniors under the Medicare system. A wellness exam is now included, and we call it our annual physical, but it's now included as a reimbursed service under the Medicare system. We've eliminated the co-pays on the preventive health care services so that seniors can get their prevention services, their screenings and their tests paid for without the necessity of a co-payment. And for our seniors, we have also started to close the so-called donut hole, which is the coverage gap for prescription drugs. This current year, our seniors are getting a 50% discount on brand name drugs. This affects close to 50,000 seniors in Maryland are getting benefits today that they otherwise would not receive as a result of the Affordable Care Act closing the coverage gap on prescription drugs. But perhaps the most important part of the Affordable Care Act as it relates to seniors is that it extends the solvency of Medicare for another decade. This bill helps to make sure that Medicare is here today and strengthens it for tomorrow as far as its fiscal impact. For small businesses, the Affordable Care Act makes coverage competitive with larger companies. Today, a small business pays about 20% more for the same coverage that a large company receives. This is particularly important in our rural communities where we have more small businesses that will be able to buy affordable health insurance for their employees. It also provides credits so small companies can afford health insurance, knowing that it can be a burden. And there's no additional requirements at all on companies of under 10 employees. So it's sensitive to the needs of our small business community. For families, it's particularly important. For example, children now up to the age of 26 can remain on their parents' health insurance policy. 18,000 Marylanders have taken advantage of that since the passage of the Affordable Care Act that now have coverage that wouldn't have it before. but for what we were able to include in the Affordable Care Act. It eliminates pre-existing conditions. Now here I must tell you, the number of people who have pre-existing conditions as insurance companies determine is just about almost all of us, particularly as we get older. We have conditions that the insurance company would rate. We've eliminated them for our children immediately, and by 2014 they'll be eliminated for all of us. We've eliminated the lifetime limits on insurance policies so that if you have insurance, it covers your needs. You don't have to go into bankruptcy. More and more families have gone into bankruptcy as a result of not having enough insurance or having no insurance to cover their health care needs. That is eliminated under the Affordable Care Act. We make insurance affordable for the individual, their credits, so that individuals can afford to buy health insurance, making it affordable for all. And the coverage we now provide is critically important. I'll give you just a couple of examples. We now require that all plans cover children's dental needs. That came about as a result of an amendment that I offered from a tragedy that had happened in Maryland. We had a 12-year-old who lived in Prince George's County, DeMonte Driver, who couldn't get access to dental care. As a result, his tooth problem became abscessed, went into his brain. He had emergency surgeries, and he lost his life. Well, no longer will we tolerate that in America. All of our children will have access to dental care. It's critically important. It's the #1 disease among children today is tooth decay. And we have made a significant progress on low-income families in getting their children access to dental care. Bernie mentioned the fact of some of the disparities we have in our healthcare system. Well, let me just talk about the infant mortality rate. It's 2.5 times higher in African American communities. We have found out that we need to expand prenatal care. This bill provides for a doubling of our funds going into federally qualified health centers. Let me just give you one example. The Greater Baden Center, it now provides prenatal care as a result of the Affordable Care Act. That will reduce the number of low-weight babies that are born and increase infant survival. That's what's in this bill, to try to expand the quality of care for everyone. In the Patient's Bill of Rights, we've talked about that frequently. I had a couple of amendments that are now law. They were never enacted until the Affordable Care Act. What does that mean? That means if you're a woman, you can choose your primary care doctor, your OBGYN. You can choose who you want. The insurance company doesn't tell you which doctor you have to go to. As a parent, you can choose the pediatrician and take care of your child. That has been changed under the Affordable Care Act. We also have provided that if you go to an emergency room and you had emergency needs, that the insurance company has to reimburse you for the cost of the emergency visit. We had chapter and verse cases of people who went to the emergency room because they were sweating, they had chest pains, they thought they were having a heart attack. They find out the good news that they didn't have a heart attack, but then they get a heart attack when they get the bill and their insurance company doesn't pay for it. Well, that's been changed under the Affordable Care Act, an amendment that I offered, that those issues are now protected. We protect you against the abuses of private insurance companies. And we also require that the insurance companies return a certain amount of those benefits in benefits, not just in the overhead. So we've done that to rein in the abusive practices of private insurance companies. And lastly, let me just talk about our taxpayers and fairness. This bill reduced healthcare costs. In the next 10 years, we're going to save about $230 billion to the taxpayers of this country. I know there's a lot of information about how this is going to cost, plus and minuses. The bottom line is, the Congressional Budget Office has confirmed this. This reduces the taxpayers' burden by getting everyone into the system. And when we talk about fairness, an amendment that I offered, I'm particularly proud, Bernie, that's in this bill, is establishing the National Institute for Minority Health and Health Disparities at the National Institutes of Health, so that we can take a look at historical discriminations in our system. Some has been based upon race, some has been by gender. And we want to eliminate those disparities because it's the right thing to do, but it also reduces overall cost in our healthcare system. This bill is not perfect, We need to improve it and move on. But what we don't want to do is take away what we've already achieved under this act, where we've taken on the irresponsible actions of private insurance companies, where we allow families to maintain their children under policies, where we've been able to expand the benefits to our seniors, where we've been able to help small businesses and families. Let's build on that. Let's move forward. Obviously, we'll wait to see what the courts do in June. I am very hopeful and optimistic that the courts will allow Congress to make these types of decisions and be able to move forward, as we did in the 1930s with Social Security, as we did in the 1960s with Medicare. Now we're moving forward to say everyone should have the access to affordable quality care in America. Thank you.